Chair, and welcome, Dr. Oz. Congratulations to you and your family on your nomination. First question that I'm asking of every nominee for this administration: if directed by the President to take action that would break the law, would you follow the law or follow the President's directive?
The President would never do that.
That's absurd. It's a disappointing answer. Now, the Medicaid program covers over 70 million Americans, and the Congressional Budget Office has now confirmed that the Republican budget plan would require taking away Medicaid coverage for millions of people. In New Hampshire, the Republican budget could take away health insurance from as many as 30,000 children. Do you support the Republican budget plan that terminates the health coverage of millions of Americans, including as many as 30,000 children in my state?
Senator Hazard, I've not seen the details of a House bill that says that. I look forward to examining it with great care if confirmed by this
So let me ask it another way. How many children losing health insurance would be acceptable to you?
I don't want children losing health insurance.
Well, then you're going to need to reject the Republican budget plan. You and I did talk about maternal health crises. Medicaid covers 40% of births in America, 50% of all rural births. So will you commit to preventing any cuts to Medicaid that will deny moms health care coverage?
I'm very focused on maternal health care. It's one of the metrics that our nation, I think, should be judging itself on. We do have to make investments, I believe, in maternal care in order to provide better sources.
So will you make sure that there are no cuts in the Republican budget plan that would deny coverage to pregnant moms and moms postpartum?
Senator Hassan, I have to be more knowledgeable about what's happening within CMS. I don't have any idea where the money is currently.
Let me be really clear. The Medicaid cuts are draconian in the Republican plan. The CBO has said that it will lead to significant cuts, and the cuts will likely lead to 10 states losing their Medicaid expansion coverage. So let's move on to another issue. Last week, the Trump administration put out a list of federal offices to close, including the only office in the North Country of New Hampshire where seniors can enroll in Social Security benefits and Medicare in person. If confirmed, will you work to ensure that seniors can continue to enroll in Social Security and Medicare benefits in person in Littleton, New Hampshire?
I don't know about why there was a decision to remove this center in northern New Hampshire, but I do believe seniors will be better treated if they can see someone in person.
Right. So do you think they'll be better or worse off in rural areas of my state if they have to drive 100 miles to the next closest office in New Hampshire to receive assistance with Medicare enrollment?
Well, one of the changes that I believe we have to make within Medicare in general is to modernize the way we communicate with our beneficiaries. It's not just about in-person visits. There should be a continuous, frequent, weekly even, discussion that goes on, that we send out, that if beneficiaries want to process, they can. Right. If we can't communicate with our seniors and their families digitally, we're giving up a huge opportunity.
Well, guess what? Some of the plans that I'm hearing from the other side of the aisle are going to cut the efforts to bring broadband and internet to this exact area of my state. It's not just that some seniors don't want to use digital access. In a lot of rural America, they can't. So we need to have offices that are open, staffed, and accessible. Now let's move on to another issue. In 2012, you enthusiastically recommended several supplements for weight loss on your television show, including a substance called green coffee extract, which we now know was fraudulently marketed. For the record today, can you confirm that you no longer believe that green coffee extract is a miracle weight loss drug?
I never said that medication was a miracle weight loss drug, but I am very...
Can you confirm that this was fraudulently marketed and green coffee extract is not a miracle weight loss drug? Yes or no?
Yes.
Okay, so let's go on to, you promoted a supplement called Raspberry Ketones, claiming that it is, quote, a #1 miracle in a bottle to burn your fat. That's your quote. Will you confirm for the record today that you no longer believe Raspberry Ketones to be a, quote, miracle in a bottle?
There are many things I said on the show. I take great pride in the research we did at the time to identify which of these worked and which ones didn't. Many of them are still being researched, like the green coffee bean extract you just mentioned.
So how much were you paid to promote these supplements?
The television show was distributed by Sony Corporation.
How much were you paid to promote the supplements?
I was paid nothing to promote the supplements.
But you promoted them on your show, and there was something called a Dr. Oz effect. You would mention them and the sales would go way up.
That was written about by the press. That was not something that I would talk
Well,
about on the show.
I will just go on the record that you have been nominated to run the largest health programs, the set of largest health programs in the United States of America. And it seems to me you are still unwilling to take accountability for your promotion of unproven snake oil remedies to millions of your viewers. And that's really concerning. Thank you, Mr.